The patient today that's going to have this new modern surgical technique used is Esther Kirkman. Esther, where are you from?
Pleasant Grove.
And Pleasant Grove is about a 60-mile drive from here.
Yes, sir.
Where did you get the idea to come up here today?
Dr. Peppercorn sent me up.
I guess that's me, right?
I think so.
Right. What we did in my office, we discovered that Esther had many skin cancers on her face. We actually took some off this side of her face with the conventional techniques of excising them, meaning cutting them off. While on the other side of her face, we discovered a very large skin cancer, and we decided that for her, the best technique would be this new modern surgical removal called cryosurgery. And this is only performed in this area by Dr. Kierney. So Esther, why don't we go in the examining room and get started today, okay?
Okay with me.
Thank you.
Esther, since your skin cancer is so large, we're going to be taking it off by an unusual and a relatively new procedure. Your skin cancer measures approximately 2 by 2 inches, which is rather large. Today what we're going to do is we are going to freeze the area around it with some xylocaine, and when I use the word freeze, I really should say numb. After I numb the area, we will scrape out all the cancer we can feel, and then we will freeze the area with liquid nitrogen. This will be frozen to about 40 to 50 degrees below zero. Tomorrow when you wake up, your eye will be swollen shut. There will be some oozing, it'll be red, it'll be very puffy. The nice thing is pain will be next to nothing because the freezing is so deep that it actually numbs the nerves.
What type of a scar will I have when it's over with?
Esther, this will take several months to heal, but when it does heal, the scar will be wider than your normal skin, but as the months go by, it'll heal very nicely, and probably in a year or so, it will be the same color as your normal skin. There may be a little thickening in the middle of the scar at the beginning, but that seems always to settle down. The area in question is this area right here. What I'm going to do is deaden this area with 1% xylocaine, and we will deaden it by doing a field block anesthesia by deadening the area around the tumor. Usually the patients complain very little about the needle. However, you can see that Esther is wincing a bit because the xylocaine is rather acidic and therefore quite uncomfortable. This specimen was biopsied several times by Dr. Peppercorn at the Marysville Clinic. We found out that some of this was not tumor. We found out that some was skin cancer and some was relatively deep. Uncomfortable, Esther?
Yes, it is.
Try not to move your face too much. I know it's uncomfortable. We're merely scraping the little islands of tumor so we can better delineate the skin cancer.
Now, Dr. Kierney, isn't using that instrument, the curette,
Does it burn a little bit?
that particular instrument is actually a technique used to remove skin cancers without the liquid nitrogen freezing as well. And the advantage here is to remove as much of the tumor before actually starting the freezing technique, in this way to greatly prevent a recurrence of the tumor.
I think the audience can tell now the multifocal nature of the skin cancer. There's really one big skin cancer made up of perhaps 4 smaller ones. The skin in between is not skin cancer, but neither is it totally normal. It's a future ground for new skin cancer, so it's important to get rid of that area just as well. Is this very uncomfortable, Esther?
Not too much.
Not too bad.
No.
This is a lot easier and simpler than going in the hospital for a couple of days, isn't it?
Yes.
Fortunately, Esther's tumor is rather superficial. I can tell when I'm scraping where the tumor ends. The tumor has a jelly-like feel. That's why I know to stop at certain areas.
How long does the procedure usually take?
A procedure like this from beginning to end would take about 45 minutes, because basically what we're doing today is freezing relatively quickly and letting it thaw out relatively slowly. The thaw may take anywhere from 5 to 10 minutes, and then we repeat it. Now we'll put on a material to stop the oozing. There's hardly any bleeding there. Esther, we had about 10 drops of blood.
10. Well, that's 5 more than I had to spare.
Uh-oh. Does that sting a little bit?
Yes.
That's a very interesting solution you have there that stops bleeding. What's that called?
This is called Moncel solution. Some of our older men in the audience would know this as the old-fashioned styptic pencil that they use for shaving minor abrasions when they nick themselves. What we are doing now is going to introduce a small needle under the top of the tumor and a small needle under the lower portion. These needles have a thermocouple, which is a thermometer in the tip of it, so I know basically where I am freezing the tumor down to.
How deep down do you put those thermocouples?
We like to get these down approximately 5 millimeters under the tumor, because studies have shown that 95% of tumors are below this level. We're using a liquid nitrogen spray. Liquid nitrogen has a temperature of approximately 200 degrees below zero. And we'll be freezing the skin to approximately 40 degrees below zero. Esther, while we're doing this, you may get some spray on your face, some little droplets. Please don't worry about that. But I have to ask you to keep your eyes closed tightly. Joyce, why don't you come on the other side and gently hold a little gauze pad so that we don't cause any discomfort around her eyes. Is that cold, Esther?
Yes.
How uncomfortable is it?
No.
Not bad.
No. It's very cold.
As you can see, I'm leaving a rim of normal tissue around the skin cancer itself. Keep your hands down, Esther, okay?
Yes, push down on the eye. Yeah. How's that better?
Is that better?
Yeah.
Atta girl.
We should make clear that liquid nitrogen is not a poisonous gas, that we're breathing nitrogen all the time. I think more than 80% of the atmosphere that we breathe is made up of nitrogen. All that we have here is liquid nitrogen, which is the nitrogen gas changed into a liquid, which lowers its temperature to 200 degrees below zero.
Getting cold, Esther?
Yeah, them come down my neck all right afterwards.
That dribbles, but that doesn't harm. It's just vaporizing.
It's cold though.
I'm watching the time very carefully during this procedure because cryosurgeons such as myself must know the amount of time it takes to freeze these lesions and the amount of time it takes to allow them to thaw out in order to get maximum benefit.
How cold are we now at this point?
We're approximately 15 degrees below zero. 25 degrees below zero is adequate. So we get a better cure rate by simply freezing to about minus 40. We're halfway finished, Esther, with this freeze. How uncomfortable is it?
It's not.
Turn to the other channel, Joyce, please. What is it reading now?
Plus.
A little louder, I can't hear you.
You're a plus. You're above zero. Now you're minus 40.
We've frozen this tumor down to approximately minus 40 degrees centigrade. As you can see, we have a margin of normal tissue approximately 5 to perhaps 8 millimeters around the tumor. And this way, if there's any microscopic portions of tumor that I cannot see, we will certainly get rid of it. This freezing procedure took about 2 minutes. Now we have to wait for this to thaw. And the thaw time will be approximately 5 or 6 minutes.
Esther, how did that go?
Fine.
You feeling any discomfort or pain right now?
No.
That was very interesting for us to watch today, and we're really glad you could come all the way up from Pleasant Grove to see Dr. Kierney here in Grass Valley. Mr. Kirkman, I want you to take good care of her during the next couple of days.
I'll try.
And you're going to have to come back and see Dr. Kierney in 48 hours so we can check that out. Okay?
Yes.
Okay, thanks. Dr. Kierney and his office staff did a fantastic job today arranging this demonstration of cryosurgery to remove skin cancer. When we return, we'll meet again with Dr. Kierney and learn more about dermatology and skin cancer. Dr. Kierney, tell us a little bit about what's thought to cause skin cancer.
Well, we're quite certain that ultraviolet light is the major factor. Things that enhance ultraviolet would be wind and also elevation. I'm here at 3,000 feet in Grass Valley, and we see a bit more than perhaps down in the valley because the ultraviolet is increased by perhaps 10% over Sacramento.
So this time of year, with the weather finally clearing up, it's important for people to protect themselves from the sun. Are there ways to protect yourself from the sun without just staying in the house? Tell us a little bit about that. How can people protect themselves?
Bob, sunscreens should be used. They have various numbers on them, as you know. I recommend routinely 15s, a 15 factor rather than the 4s and the 8s. And the reason why is sometimes we forget to put it on, sometimes we perspire, we sweat it off, so to speak, and so it acts like a lesser sunscreen. So I go for the maximum, knowing that people will not put it on all the time, and they will also perspire and sweat some of it off, so it's less effective.
So these are lotions they can get in any drugstore?
Yes.
Okay. What are some brand names?
One of the nicest is Pre-Sun 15. The reason why I like it, it has a gel form that the men like because it goes on like an aftershave. And there's a creamy Pre-Sun 15, which the women like. Another one, which is a fine one, is Solbar Plus 15. This has a PABA derivative in it and another sunscreen in it. And this screens out perhaps a broader range of ultraviolet light.
So they can just walk into any drugstore and right on the shelf they'll see all of these different products just sitting there, and they should look for number 15 on the label.
Yes, they're all good products.
They don't stay on the skin all day. How often should they reapply them if they're doing some activity and sweating? How often would you reapply it?
Most of them stay on to a degree after you bathe, swim, or perspire. The Pre-Sun 15 stays on to a large degree. But I think that if somebody hops in the pool or hops in the pond or lake, they should reapply when they get out because at least half has rubbed off.
Now today we've seen a very interesting demonstration of removing skin cancers with cryosurgery, meaning the cold surgery, as you discussed very well. But this isn't the only way of treating skin cancers. What is done at first when a patient comes into a dermatologist's office with a bump on the skin that may be a skin cancer? What do you do first?
Bob, I think it's very, very important to take a biopsy prior to any eradication of a cancer, whether it is excised, whether it's scraped off, burned off, frozen off, or x-rayed.
Now, biopsy means?
Biopsy means we take a segment of the tumor.
A little piece, right?
A small piece. We want to know, is it a cancer? If so, if it is a cancer, what type, how deep, and this tells us how to best treat it. So some cancers should not be treated by cryosurgery. Today we treated a basal cell tumor. Basal cell tumors rarely spread internally, so this is a fine type to treat. Some squamous cell tumors, which theoretically can spread internally, can be treated this way. Malignant melanoma, which is the third major type, should not be treated in this manner.
That's the most dangerous type of skin cancer.
Yes, very dangerous and, thank goodness, relatively rare. I've been in practice approximately 13 years, and I haven't seen over 20.
That's very interesting. You, as I mentioned to our audience earlier, you were in Marysville for 7 years at the Marysville Clinic where I am right now.
Yes, I served my apprenticeship there. This is what I say to my friends.
I see. And then you decided to come up into the foothills. You like it up here?
Yes. We just came for a climactic change. My 7 years at the clinic were good years.
So we'll think of you when we have our 105-degree summer coming up here.
Well, it's only about 100 up here.
Oh, just 100.
It gets quite warm.
Okay. That's interesting. People often ask me, what exactly is meant by dermatologist? Dermatology is really a new concept for a lot of people outside of big major cities. What does a dermatologist have to go through to get his training?
Basically, the dermatologist spends 3 years after his so-called internship just doing skin procedures and seeing skin lesions. The dermatologist during his 3 years learns how to diagnose skin diseases, treat them, learns how to do many surgical procedures which are done on the skin, and actually most of us read our own skin pathology slides.
So a dermatologist is taking care of all diseases of the skin, the hair, the nails.
That's right.
Even mucous membranes, the mouth, and other areas of the body.
That's right.
He's qualified to do any type of surgery removing lesions from the skin as well.
That's right.
Who do you feel is the appropriate physician to remove a skin cancer?
I think the dermatologist is the number one physician, because not only can he take it off in a reasonable manner, but he understands the biology, or he understands how that skin cancer behaves, what it can do, and what it will do.
He really knows in detail what's going on in the skin.
That's right.
Whereas other people may just look at the skin, he really knows what's going on inside.
He understands the biology of the skin, which is very important.
And when people notice little growths on their skin, those aren't always skin cancers. Is that correct?
That's true. Most of the growths that we get as we age are benign, minor lesions. I tell patients to watch for certain signs. If the tumor, or I should say the growth, changes in color, blackish blue with a shine, if the tumor increases in size, for example, it doubles in 6 or 9 months, that's a bad sign. If a growth bleeds and you haven't bumped it, if a growth itches all the time, these are things that we're cautious about, and if these things should occur, at least they should give us a call.
I use the rule that if a new growth appears on the skin and stays there more than 6 weeks, it should probably be checked out unless you're absolutely certain you know what it is.
That's right.
Little
That's
rule.
right.
You don't see dermatologists in the hospital very much. A lot of doctors, surgeons are in the hospital doing work. Why don't we see dermatologists inside the hospital?
Fortunately, during the last 20 or 30 years, we've gotten a lot of new medicines that enable us to treat our patients on an outpatient basis. This allows us to keep costs down to a minimum and basically keep people out of hospitals. And most of our procedures can be done, for example, the one this morning, in the office. With a competent office nurse and the proper equipment, you can do it in the office and save extra fees and charges that one would occur in a hospital.
How many dermatologists are there in our immediate area?
We don't have many in Northern California. When I say Northern California, I'm talking about above Sacramento. We have four or five in Chico, a gentleman in Auburn, one here in Grass Valley, one other gentleman in your area in Yuba City, and basically that's it.
Don't forget me in Marysville, of course. Right?
Oh, yes, Bob. How could I forget the Marysville Clinic?
That's right. We never want to forget that. Again, I would like to invite you to write to me at the Marysville Medical Clinic with your suggestions for areas and people that you'd like to see on this program. The Medical Explorer, as you know, is a public service program, and I really do want to hear from you with your comments and suggestions. Please write to me at 800 3rd Street, Marysville, 95901. In my next program, the Medical Explorer will take you behind the closed doors of the operating rooms at Rideout Hospital. One of our area's highly skilled general surgeons will take us on a guided tour of the operating suites. I'm Dr. Robert Peppercorn, your Medical Explorer. Thank you for joining us tonight.